by yourself. You're that competent enough to.
Welcome, my dearest sister, my colleague, my mentor, and my darling friend. I have 1001 names to describe you with, and but I'll stay on these ones today. And so people watching us from everywhere around the world, my name is Fola Shade. I'm one of the facilitators at Unified OSCE. What we'll be doing today will be to introduce to our people who are registered nurses in the United Kingdom. As you can see me, I'm a registered nurse in Nigeria and also in the United Kingdom here. And IBT, Ibitola, she's a registered nurse and she's a senior clinical advisor at Northeast Ambulance Services. So she's going to tell us many beautiful things about this role that she took over in close to 2 years. I think it's almost 2 years now. And she's going to intimate us with everything about it. The beautiful things, the pros, the cons, the challenges, how to navigate into the system and how to keep going in the system and keep going stronger and stronger. So she will let us know, because this might be an opportunity that you want to be opened to. It might be a pathway that you too want to follow. So she will let us know what we should expect is something that worth giving a go. She's been there, she's seen it all, and she's the best person that I have at hand to tell us things about it. And I'm sure she's not going to mince words with what she's enjoying there and the skills you want us to possess to her if you want to come into it. Just bear in mind, we are not campaigning or canvassing for people to join the ambulance services. Just like any other job around the world, it has its own challenges. It has its own beautiful, beautiful, beautiful sides. And I think the beautiful sides are maybe more, maybe to her or maybe to me and some of us that are doing it. So here you are on the floor with me today is IBT. She's a senior, and I mean, when I say senior, she's a senior of the seniors. So it's nice to have you here.
Yeah, thank you, my darling sister and friend. Yes. I bet you are one of the seniors. I will call senior as well. So thank you for having me. And thank you for the opportunity to, enlighten people about the role of the senior clinical advisor with the with the ambulance service or NHS 111 and NHS 111. I'm happy to be here and
thank you.
I appreciate you for the opportunity and well done for the very good job you've been doing. I see you're really trying and doing a lot. I wish I can be like you when I grow up. Thank you.
Like you.
Yes, so I'm going to start by, in just as my sister has said, my name is Bitola Omojola. I'm a registered nurse, and at the moment I work with the Northeast Ambulance Service as a senior clinical advisor. So, I've been there 2 years now, and, so far, so good. There's no job with no downside to it, but I will say that this role is one that, you will enjoy. A lot of people will enjoy. And if you have been thinking of leaving, bedside nursing, because of the physical stress and all that, this is one of the roles that you need to consider. If you have been thinking of how to advance in your career, this is one of the roles what the role is about. So the role of the senior clinical advisor with the ambulance service, NHS 111, is a role where we do telephone triaging, telephone assessments. We assess patients over the phone, using a clinical decision system. So there's a clinical decision system that we use, and to assess patients and arrive, at a disposition. And what do I mean by disposition? It is the like an outcome that you want for the patient. So, and basically, what we do, is the assessment of the patients, and then sometimes we do a lot of hair and treats. We do home management, where we get to tell patients how to manage their symptoms at home without going to the hospital. So we also signpost patients to services. So we signpost to GPs, we signpost to out of hours services. We arrange ambulance for patients. We signpost patients to walk-in centers. We get to book patients into appointments, and so that they can be seen. We also, arrange ambulances. We decide on the category of ambulance that is suitable for patients. So we can actually, downgrade or upgrade the ambulance. Say we've assessed the symptoms and you think, oh, I think this patient needs a higher response. I think I want the ambulance to get to the patient earlier than this. So you have that, you can override the system as a clinician. So let me paint a picture of how it works, because I know a lot of people will wonder. I've had people ask me, oh, so you're the one that pick calls when we call 111 or 999. No, we don't pick calls. So if you're looking to be a senior clinical advisor or a clinician, we also say we are clinicians. We don't pick the calls. So we've got the health advisors who pick calls. They are not medically trained, but they are trained in using the decision system known as NHS pathways. So they go through questions with the patients, and then they arrive at a decision, an outcome. And, when they arrive at an outcome, they pass it over to the clinician to make. So there are different criteria for them to pass job to the clinician stack. So say the case is too complex, is wider than what their scope of practice is, they pass to clinician. Say the patient had declared a medical history, they cannot deal with that, they pass it. When a patient refuses an outcome, they pass it. So those are the cases that come to us as clinician. So what we do is we've got a queue on the system that we monitor. So we just go into the queue. The queue is prioritized. So we use colors to prioritize the queues. There are some we have to call back in 30 minutes. Some we have to call back in 2 hours, like that, some 1 hour. So depending on the level, I'm trying to
the urgency of the
yes,
like the urgency of their healthcare need.
Yes, healthcare needs. So that's what informs our decision, and the colors. So we pick the case, and then we go into the job, and we ring the patient back. So if you hear a 111 advisor tell you a clinician will call you back within so hours. So we had a clinician, and that's what we do. We ring patient back, and then we go through what the health advisor had gone through with the patients, just to be sure that we've got the right information, which is what we will base our decision on. So I've said we use the clinical decision system. So we've got the NHS pathways. In the clinician role, I know some other organizations use other decision. Other organizations use other decision system, like the PACS, the MTS, the Manchester Triage system, and all that. But I'm not going to bore you into I'm not going to bore you with the details of all those. So it's just the NHS pathway clinical decision system. So as a clinician, because you've got medical knowledge, you've got clinical experience, when a health advisor deal with a job and you think you're not comfortable with what the system is bringing to you, like, I'm not comfortable, I don't think I want this patient to wait till tomorrow to see the GP, I can override the system and say, I, as a clinician, you take that responsibility over yourself to override the system, and then, and decide what's the level of the care, appropriate level of care for the patient. So in a nutshell, that is what we do. We do telephone triaging, assessments. We do a lot of talking on the phone. Yeah. Now, the next thing I'm going to go into and talk about is the pros and cons of the role. Like I said earlier, there's no job without downsides. There's no job without the cons, the negatives and all that. So the role of the clinical senior clinical advisor. Let me start with the cons. The negative side is because you are not getting to see the patients. Is one of the downsides, through the role. And this is what I mean. Sometimes patients, they
they downplay their symptoms.
Exactly. That's the word I'm looking for. I don't know why English is leaving my head today.
You've not been teaching 9 years now, so you actually
patients downplay. Yeah. Patients downplay their symptoms. You see, a patient can be in pain. You're asking the patient how severe is this pain, and the patient is saying, it's not really severe. Now, that kind of a thing, when a patient downplays symptoms, it affects your own judgments. And instead of, it affects your judgments, and it can affect the level of care you will give the patients. So that's one of the downsides to the patient, to the role, because in the hospitals, you are getting to see the patients. Even if a patient is telling you, I'm not in pain, when you see some facial grimacing, some reactions from the patients, you can tell this patient is in pain. But this one, you are not seeing the patient. And when the level of care that you give to a patient is compromised, then it means the safety of that patient is compromised. So they can come for you and say, well, the patient's safety in this case has been compromised. So that's one of the cons, one of the negatives to the job. Another thing is you can miss a point by either, any little distraction, you're not listening well, or you don't even understand the English, or, because they use the accent, I'm telling you, the accent, they have their own, like, broken English they speak to. So on the phone, they say some things to you and you're wondering, what's this person saying? I can't even understand what this person is saying. I've got to assess a patient sometimes, and the patient speaks this Scotland accent, very thick. And then at the end of the call, I didn't even know the patient was threatening to use more overdose.
Hey.
He was threatening to use more if we don't send an ambulance. Now. But because he annoyingly dropped the call after, what he said, I didn't even think that was what he said. I didn't hear. Not that I didn't think. I didn't even hear at all. And then what I did was the The patient cancelled the ambulance himself and said he dropped the call on me. And I just cancelled the ambulance. And then a week after, my manager called me. I was like, so those are one of the things we face. But thankfully to my manager, she understands that I didn't understand the accents.
And I think there's a policy for rude patients too. Maybe,
yes,
I don't know
yes, you can actually
do policy for abusive patients.
Yes, exactly. So my manager understood. Yes, my manager understood that I didn't understand the accent he used for me, and that was why, but she said to me, you should have just left the ambulance in place. And so those are the things, one of the things that we experience in the job. Another thing is they get to audit you every month.
That's the assessment. And you're not afraid of all this continuous assessment?
Yes, every month they listen to your calls. At least 5 you must pass. You must pass at least 5. So they listen in to your calls. So the audits, as much as it is to help to, build you to understand where you have made a mistake, for them to give you feedback and all that, it still, gets to affect you in some area, because you know that they are listening to your calls, and somehow it affects your, should I call it morale?
Sometimes. Yeah, I think I share in this. Sometimes this month, I actually took a call, and I really do not know how I manage myself, because I'm someone that used to be like very passionate with my patients and all that. And that was a cartoon call that, even as ex-advisor, like call handler, I think I remember my trainer saying repeatedly that you don't take a cartoon call all by yourself. You must get someone to support you. And the moment you know that your call is going towards Cat 1 in our hub, I don't know what happens in your hub. There are some red papers that have been printed on our tables. You just lift it and you have people running to you from every side. And the team leader will come to you. If you have clinicians that are free, they will come to you. The clinician will plug into you, start listening to you. Team leader will come over. And I just took that. I think was it over Sabina, or maybe I was extremely passionate. I finished the call, right? I organized Cat 1. Was like respiratory issues. And I dropped the call, but immediately I knew I had to stay with patient. Institutionally, our policy is to stay with the patient on the Cat 1, because we want to be sure the patient is not collapsing without anyone with them. Unfortunately, this patient of mine, this patient was alone, which actually made it that I should have stayed with her. So, but I just dropped the call. I just dropped the call and I just continued. Then I remembered that I should stay with her. I went back. When I was staying with her, instead for me to just call for help, normally they help. But instead for me to go, mommy, she's doing great job for you. For me to just call, call one of the team leaders. I just continue. I said, let me ring 999 so that they will come to you quickly. Unfortunately, 999 will not pick that call. Honestly, that call was non-compliant. That was like the second non-compliant I will be having. The person who did that said, oh, I knew she knew what she should do. He said when I first dropped the call that she knew but she knew she should stay with this patient. And when I called back, she was happy. Unfortunately, I called back. I now left the patient and put her on hold and called 999 again. So that call was non-compliant. I saw my mistakes, and I think the aim of audit is to help people to grow. If we see it that way, well, I know it's not actually easy in most situations to see it that way, for some reasons. But that, in fact, she had to, second day, she monitored my rota. She knew I would be on shift. She said she didn't want me to feel bad. She didn't want me to feel less of myself because she knew I've been doing great jobs and all that. That she would talk with me, and she waited on me the second day I was on shift, and she talked with me for a long, long time before I started those courses. So I knew that, like you said, I'm failing, and they don't use the word failure anyway in our home. They will say you are not compliant, but whatever. However,
yes, non-compliant can dampen your
It
morale
is.
because when you fail audits, then you feel, oh, am I not doing well, or and all that. So, but it's basically not to find faults. It's to give you feedback, and so that you know where to improve on on your calls. Another cons to the role is it's a very broad one.
It is.
It's not a role that is streamlined to only pediatrics, or say I'm a mental health nurse and then it's only mental health cases I will be taking and all that. No, you will take all sorts of cases. Pediatrics, mental health, dental. We even do dental.
Yeah, we do.
We do dental calls.
We do and all that.
Think of anything. Now I've even had a patient who had bats entered his house and he called the ambulance service. He needs somebody to come out and chase this bats away. So you deal with all sorts of cases like that. You will deal with. So it's a broad one. It's you have to keep reading, keep updating yourself, keep getting abreast of information. And a lot of times, policies, procedures keep changing.
Yeah.
We get to, keep doing the updates.
Oh, yeah, take that off. Tell her to give her a nana. Sorry, sister. So
actually, non-compliance can, can dampen your morale because, when you fail audits, then you feel, oh, am I not doing well, or and all that. So, but it's basically not to find faults. It's to give you feedback, and so that you know where to improve on, on your calls. Another cons to the role is it's a very broad one.
It is.
It's not a role that is streamlined to only pediatrics, or say I'm a mental health nurse and then it's only mental health cases I will be taking and all that. No, you will take all sorts of cases. Pediatrics, mental health, dental. We even do dental.
Yeah, we do.
We do dental calls.
We do and all that.
Think of anything. Now I've even had a patient who had bats entered his house and he called the ambulance service. He needs somebody to come out and chase this bats away. So you deal with all sorts of cases like that. You will deal with. So it's a broad one. It's you have to keep reading, keep updating yourself, keep getting abreast of information. And a lot of times, policies, procedures keep changing.
Yeah.
We get to, keep doing updates the clinical decision system. So say we are using version 37 now.
Oh, yeah, 37. We are in 38 now. 38 just came yesterday.
Yes, our 38 is not yet.
Oh, our 38 is not. There is no training for it anyway, so that's a breath of fresh air.
So we keep doing training to get the new updates from the clinical decision system. So I mean those are the cons I can think of for now. And then any compromise in patient safety. Let's say a patient died, and they have to trace the what caused say is an unexpected death, and they have to trace. Maybe they've gone to coroner and they want to trace the cause of death.
And it was a delay.
Yes, you had, handled the call. They will look into everything.
Even some
and they
expected
will come
deaths,
to you.
if they were not well managed.
Yes,
I think there was one
well
that
managed. Yeah.
maybe I don't know what happened with the palliative care whatsoever. Be mentally alert.
And at a lot,
Yeah.
always,
One thing I think I love
always.
about it is the generativity, sort of.
Mm-hmm.
I don't know, like it's sort of general. Everything you are seeing in the clinical side, you are seeing them. Like it's just like you're not seeing them face to face. And like not a specialty per se that you're a respiratory care nurse and all you are doing is respiratory care.
Mm-hmm.
That's great if that's what somebody wants.
Yes.
Yeah. You are a breast care nurse, that's the only thing you are doing. But
Mm-hmm.
this is, to me, it's like you are still seeing everything that is
Everything.
happening.
Yes.
Everything.
Yes. So we deal with everything, pediatrics, days old pregnancy, midwifery is there. You get to do gynae, prolapse, and all sorts
I've
of
handled
things.
many
So it's
cases of
quite
prolapse,
broad.
rectal, uterine.
It's a broad area.
Yeah,
Very broad
testicular
area.
torsion. Honestly,
Yes.
I've seen so
Yes.
many things.
Palliative. And this is one of the pros. You get to learn a lot. You get to learn a lot. Because by the time you deal with those cases and you're not really familiar with them, you can read them up. We have a website that we use, a website, I've forgotten the name now, where we check disease conditions.
Okay, we use NICE. We use NHS sites. And I think
NHS sites.
Yeah, we use NICE too.
Yes.
And we actually get like consistent updates from NICE.
Updates, yes. So you get consistent updates. They send it out to say, oh, okay, so this is the latest with this. You get updates with even medication, expired medication. They let you know, oh, okay, so so medication has, been causing this problem. So look out for these cases. You get to hear more about public conditions that are prevalent and stuff like that. So
this will be the first point of access for those new conditions. You'll be saying, okay, what's going on?
What's going on?
Outbreaks. We are quick to notice
So when there's outbreak, you get to learn. Know early. You get to learn what to do, how to deal with it, and all that. So that's one of the pros of the job. You get to learn a lot. Another pro of the job is you are an autonomous practitioner. I mean, it could be prone and it could be a con because, there are times that practicing alone too has its, downside, like you're not sure of what you're doing. But you have colleagues around that you can rub minds together. But basically, it's just yourself with your system, with your phone calling patients back. You see, so that's for me, is still one of the pros. You get to decide on the care of patients. You get to use your initiative a lot. Yes, so you get to use it a lot, which is one of the things that builds you as a person. It builds you as a person. So another pro to the job, to the role, is the flexibility of the role, is a flexible one. And when I talk about flexibility, like in my organization, you can decide to slide your shifts. We do shift slides. Say I'm on a long day tomorrow and something came up. I don't want to call in for emergency care or anything like that. I just speak to my manager. In fact, they encourage you to call them before you call the sickness absence line. Call the manager first and speak to them and let them see how they can adjust, your shifts to be flexible. So I'm on long day now and something came up. I need to quickly go and, attend to. They can say, okay, why not come for a 12 midday to 12 midnight shift instead of a long day? So it's flexible. It's quite flexible. Another thing is, when I talk about flexibility, is you have the opportunity to work from home.
Yeah. Okay.
I work from home. So once they see you, you can stay by yourself. You're that competent enough to stay by yourself. It's not compulsory. Lots of people choose not to work from home because they like the interactions in the office and all that. I also enjoy it, but I guess I just have to choose my health. I don't like the cold. So going to work, waking up early, going to work in the cold was what made me, decide to start working from home. I need that warmth in the room. So you can work from home. So if you're been thinking of a role that will make you to work from home, and this is one role that I know, and you can get to do your extras from home, if you know what I mean. So and so that's one of the pros of the job too. Another thing is the job is enjoyable. You get to speak to patients a lot. You get to interact with patients. There's some patients, the elderly ones especially, I've noticed that it's not because they are really, really, really sick. They just need someone to speak to. They are lonely. They need someone to. Yes. I mean, after speaking to them, you hear them tell you, "Oh, I feel relieved. Oh, I don't even think I need to go to the hospital again. After speaking to you, I feel relieved." So that's one of the pros. You're happy. You're affecting lives, touching lives, and which of course nurses do every day. But you get to speak to patients. You get to, over the phone, you get to hear them tell you things they wouldn't even tell you ordinarily. But they will kind of open up to you and in the course of the assessment and all that. So that's about the pros and cons of the job.
Thank you very much. You've exhausted everything. I don't think you've left anything on so much.
Okay.
Yeah, just looking at career advancements.
Right. Okay. So another pros before we go to career advancement is that the job is not physically demanding. It's not physically demanding. It can be mentally demanding, especially when you have some mental health cases to deal with. You have some abusive patients. You have some
suicidal
patients that it can be mentally challenging. You have patients that will tell you, "I can't understand your English. I can't even understand you." And then I ask them, "Am I speaking Spanish?" "I'm speaking English, but you are saying yes. You are answering the questions I'm asking. So how come you don't understand?" I mean, it can be mentally challenging, and but physically it's not challenging. It's a job, you sit and do and
your joints.
Yes, you get to go for comfort breaks, and you can, if you take a challenging call, you can decide to take some minutes to just cool off your head and stuff like that. So let's move on to talking about advancements. So as a senior clinical advisor with the ambulance service or NHS and the NHS 111, you can actually advance as fast as you can and as fast as you want. And this is what I mean, because you are an autonomous practitioner already. You have been managing your caseloads. They see you as a practitioner, somebody that can work autonomously. So there are courses that you can take in few months, and then it pushes you up and you can become a nurse practitioner.
That's sweet to hear.
So some example is the physical you sit and do and
your joints.
Yes, you get to go for comfort breaks, and you can, if you take a challenging call, you can decide to take some minutes to just cool off your head and stuff like that. So let's move on to talking about advancements. So as a senior clinical advisor with the ambulance service or NHS and the NHS 111, you can actually advance as fast as you can and as fast as you want. And this is what I mean, because you are an autonomous practitioner already. You have been managing your caseloads. They see you as a practitioner, somebody that can, work autonomously. So there are courses that you can take in few months, and then it pushes you up, and you can become a nurse practitioner.
That's sweet to hear.
So, some example is the physical assessment course, the clinical skills, we call it, clinical skills. So most universities will take on board nurses working for NHS 111 ambulance service, that are in specialist roles, because they know you have the ability to practice autonomously. So you can do that course, and in few months, you are done with the course. So after that, then you can, move on to doing other things to boost your practice, because as a nurse practitioner, you want to be able to prescribe. So you do a prescriber's course and all that. But talking about advancement, you can choose to be a nurse practitioner. You can choose to be a clinical lead. You can choose to be a clinical section manager. Someone that manages colleagues, management, both in clinical and managerial roles. So there's a lot of opportunity in the ambulance service.
So are there sponsorship for all these, or they have to be self-sponsored? Or if you feel like self-sponsoring yourself, would they be refunding you if they find you capable?
So talking about sponsorship for courses, most times, what you need to do is just put yourself forward. They are ready to sponsor you.
Okay.
They are ready to sponsor you. Most times, they are ready to sponsor you. So what you need is put yourself forward. Oh, I'm interested in this course. I'm interested in this. As long as there's funding for it in the organization, they are always ready to sponsor for courses. And if you self-sponsor and you let them know that, you are doing this course, can they refund you? Some organizations are, that's good. They can actually refund you, as long as you are doing a course that is related to the role and is going to be for the benefit of the organization. So, in terms of sponsorship, yes, they can sponsor you for courses. They can actually sponsor you for courses. I've had to be, I've gotten sponsorship like 2-3 times with my organization. You have completed your competencies, then you can apply to, move up the band and become a nurse practitioner, an advanced nurse practitioner, or, whichever role you want to go into. So you can also work as a mental health nurse, with the service, ambulance service, NHS 111. That's another thing I forgot to mention. So if you're a mental health nurse, there are some organizations that they employ mental health nurses basically to deal with mental health cases on the clinic stack. So because you're a mental health nurse, does not mean you cannot work with the ambulance service or NHS. So let's move on to talking about available supports. To be honest, I think because the role is a broad one, so you get enough support. You get trained to start with. After training, they don't stop supporting you. And like Sister Shade has rightly said, you see, when she had that call, manager had to come to make sure she's fine the other day. So those are the kind of supports you get. Let's say you've taken a call that is really disturbing to you, or a challenging call, you get support. They encourage you to debrief with colleagues around. and talk about it, and that way you get over it. And if it's taking you long to get over it, there are support. There are lines you can call. Your managers are on ground to support you and all that. So it's the areas you get support. I've still mentioned that organization differs, from each other. Like but basically you get supported because they know that the role is a broad one, and it's a broad one. It's a lot to take in. So they don't hammer on your errors like that. They try to protect you. They know, okay, oh, you've got a lot to take in anyway. So next time, don't do it this way. Next time, why not do it this way? We have clinical supervisors that are there to peer-to-peer supervision, where you can, talk about what you are going through, what is happening, where you have challenges, calls that you've taken that you think, oh, this call went like this, how should I have handled it better and all that. So we've got a lot of supports in place. And organization, in the organization as well, there are websites where you can go and read up stuffs and like that. So there are lots of supports in place for you to be able to perform excellently in the role. So it's not a role that they will just dump you there and say keep doing. And that's why the audits, for instance, is in place. It's for you to know how you are doing and you get a feedback. It's not to condemn you, or it's for you to have a feedback and know where you need to improve on. So that there are available supports. And of course, myself and our Sister Shadesu, we are here, to support as well.
Yeah. So I think I'm getting more experienced, so I can support. So what if I ask, while on the ward, we used to target like 1 to 4 patients, which never came as possibilities. They were just like on papers. Do you have like target call numbers, or you are just free to do whatsoever you do?
So on paper, like you've said, we have target call numbers. You have to be able to make 4 calls in 1 hour. So it's 4 calls per hour. But most times it's not feasible, and they know it's not feasible. Because I can be with a patient, talking to a patient for 30 minutes. So there's allowance for that. They put that into consideration. So it's not, if you don't make 4 calls, they'll come for you. I've worked with the ambulance for 2 years. I've never had my manager call me and say, oh, you've not made this number of calls, or no. So there's the allowance and I think the general rule, especially for NHS 111, is 4 calls per hour. I don't know if that operates in your op.
Yeah, I've heard about it, but I'm not sure I've met 1 to 4, because
exactly, and they don't come for you.
You are even like the one I was saying, if it's CAT 1, if you have to stay with the patient, and sometimes before you finish extracting all the needed information from some people, then you have to stay with them. Or maybe patients that are not compliant. Of course, CAT 1 is not likely one will be on that for 1 hour anyway, because it's very, very on the points to be done immediately.
Yes.
But there are calls that will just hold you, especially some talks-based issues that you'll be just surprised that what's going on and all that. You have to put them on hold, call talks. So sometimes it's quite not feasible. And I've been wondering whether I'm not really...
Especially when you have mental health calls.
Yeah,
that you have to deal. That one too is sometimes 45 hours you are still on this.
Yeah, for 5 minutes.
Patient. So yes, I think basically what they're after is at the end of the day is patient safety that they're after. Because if you rush a call, then you're bound to make mistakes. So it's better you take your time and listen to the patients, listen to everything they have to say. And although one of the things we do and you need to learn to do is call control.
Yeah, call control.
You need to be able to control the call, because you see a number of, especially the elderly, they want to tell you what happened in 1970, something, how they took their this thing out and, had pacemaker, this, that. So you have to, be able to redirect them and bring them back to the topic of the day and, control the call. But you still need to take your time to be able to understand what exactly is happening to the patient. And that's, what we give you the appropriate level of care that you want for the patient. So at the end of the day, it's all about patient safety. So though they say that you have to do 4 calls in an hour, but it is not feasible. And I know that a number of them, the managers, the commissioners, they know, because we have KPIs that we have to meet too. So, once an organization is not meeting the KPI, the commissioners start doing meetings with them, coming for them, and then they want to come to you and say, oh, okay, we are not meeting our KPI, so you have to, be this up and doing and all that. But at the end of the day, it's patient safety first.
Thank you very much, ma'am.
So, what else have we not talked about?
I don't even actually think there's anything we've not touched. Honestly.
So we need to talk about the skills that you need to be able to do the job. Number 1 skill that you need is active listening. Active listening. You need to be able to listen to the patients, extract when you are listening actively, you're not only listening to, what the patient is saying to you. You are listening to the tone, how the patient is saying it. That's what will make you, you will be able to judge from how the patient is speaking and all that, a lot of things. Take, for example, a patient that has jumbled or slurred speech. You need to be able to listen actively and pick that, oh, I think this patient is slurring. And then you'll be able to ask, is this the way you talk?
Yeah.
Or this is a recent thing.
Too. And I've had situations where I'll be hearing patients trying to take deep breaths to control pains. And I will have to probe, okay, is this?
Yes.
But no, but I'm trying to take in some air to control the pain. I've had such patients too.
Yes. So you need to be able to listen and listen for, some background noises and all that. There are times that is a third party you'll be speaking to, say the mom, the dad, or the kid, or you have to be able to listen to, sometimes you hear the kid crying in the background. If you ignore the cry, you might miss it, because it might be the patient crying and you're talking to the mom. So you want to find out, oh, is that so I can hear crying, and then they say, oh yes, it's crying, it's in pain. And so you need that active listening skills. Another skill you need is probing skills. You need to be able to probe patients. You need to be able to bring word out of them. You need to be able to use open questions. So the clinical decision system, the NHS pathway, we give you questions to ask the patients. You need to be able to rephrase, paraphrase, and, so that the patients will understand what you're trying to ask them. Because there are times some patients they just deviate away from what you're asking them.
Yeah.
Either because they don't understand it, or so you need to be able to probe a lot, and so that you don't miss out anything. And you will be able to, arrive at an appropriate level of care for the patients. Another skills that you need is the negotiating skills. That one
in this country, that's very, very needful.
You have to be able to negotiate with patients, because patients will tell you no. You say, I'm not going to that A and E that you want to send me to.
I want
want
to
an
send out
ambulance
plans
out.
now.
Yes, now, right away. So you need negotiating skills to be able to negotiate with patients with, okay, I have assessed you, and this is what I think is clinically appropriate for you. And then be able to, explain to them, negotiate with them, okay, what if we do it like this? And what if you bring a neighbor or a friend to come and take you to A&E?
And
Because
so in most situations they agree, but if
they
doctors,
agree.
they will not
Yes, they agree because most of them will be like, oh, okay, you are the experts. So I agree with whatever you tell me. But some of them can be really so that they won't even, they will
They'll not
insist
budge.
like, no, they won't, but this is what I want. And this is what I want. So you need that negotiating skills. You need communication skills. You need to be able to communicate to patients what you mean. Let patient be able to understand what you mean, and communication skills is very important. Is very important. How to speak to them, how you say things to them, the things you don't say to patients and all that. So you need to learn, the act of communication. You need to learn the act of communication. Another skills that you need to be able to do the job is you need to be is this a skill or a quality really? You need to be empathetic.
Yeah.
I think that's more of a quality. You need to be empathetic because especially because you're not seeing the patients, you're not with them, they're speaking to you on the phone, and you also need to not to be judgmental.
Yeah.
Not to be judgmental. So those are some of the qualities that you also need to be able to do the job. I'm trying to wrap my head around.
I think we have to be resilient too, because some of these calls can drive someone crazy. If you are not resilient and you just want to pack and go.
Exactly. And you need to be able to, be calm in the face of, there are times you want to give it back to the patient the way they are giving it to you.
Yeah.
There are times, but it's a recorded line, and you can't afford
to be unprofessional.
Just say anything unprofessional, and so those are the skills and the quality that is really essential in doing the role of performing well the role of a senior clinical advisor. So do you have more to add?
I have nothing to add. You are here to tutor me, you are here to mentor me, and to mentor everyone that is listening, that will be watching at any point in time. And I have loads of appreciations to pass across to you for your time, for being so friendly, for being so humble, for actually paving ways for us to see that. I don't think many of us are really thinking about that area. One thing that I'm not sure of is whether they recruit from any part of the world, like people recruit band fives and all that. I've not seen it happening in my trust. I don't know whether it happens in your trust. Like, do they recruit from anywhere?
No, I don't think so, because the role is a band 6 role. Okay. So when you're starting, you start on band 6. So they don't recruit from outside.
All right.
But they recruit, within the UK, and some of them have got sponsorship available. They sponsor and all that. So, I mean, if you're interested in the role, it's a good one, and I will encourage anyone to do the role. It's really a good one, to be honest. I've not regretted joining the ambulance service. I have not regretted for once. I mean, there are days you feel, oh, this job is, but it's everywhere.
Yeah,
I enjoy it.
Like one of my team leaders would say, sometimes you'll be on top of the mountain when you are doing this, and sometimes you just feel like you are in the valley.
Yes. Yes.
And you will do this job and it seems like you've never done this job and you just want to
Yes.
not do it again. But then there will be other times
Exactly.
you are up there.
Yes,
I've
I
witnessed the
agree.
ups, I've witnessed the downs. In a way,
Mhm.
maybe not so many, but I've witnessed both. Thank you so much, IBT, for tuning in to be with us today. And hopefully one of these
My
days will
pleasure.
still give us audience because we love your face,
No
we love your
problem.
voice, we love what's here. It's filled up and to the brim and overflowing. God has really endowed you with all that it takes to be a good mentor. We appreciate
Thank you.
it very much
Thank
from
you.
Unified Team.
Thank you.
We only pray that you continue mounting up with wings as eagles. Thank you so much for your time. Thanks for opening
Thank
our
you for having me.
Thank you.
Thank you for
We are
having me.
thanking you
Thank
in
you so much.
advance that you will come back again.
No problem. It's always a pleasure.
Thank you very much.
Thank
Have
you
a good one.
for having me.
Thank you.
Yeah, and thank
Bye.
you for all you do too.
Thank you, Ma. Just learning from you guys.
All
All right. Bye.
right.